Was it the failure to perform an emergency C-section versus moving forward with a vaginal delivery the cause of your baby's brain injury at birth? Want to know what I'm getting at here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I am a childbirth injury and medical malpractice attorney practicing law here in the state of Maryland, and I would like to quickly talk with you today about that question. And the foundation of this question is going to be in the context of when a baby is in fetal distress, no longer tolerating a vaginal delivery. Maybe there's some issues with reduced levels of blood and oxygen, or HIE, and this is what is going on with the baby. And so now the question is, with all of this going on, reduced level of blood and oxygen, fetal distress present, should the doctors have continued to go with the vaginal delivery, or was an emergency C-section the better way to go? Now, for this video, I would like to help you understand how this comes up. Sometimes we will have parents who will contact us, and that is what will be on the minds of mom. Mom will be like, well, Mr. Boston, I just don't know. Should they have went with an emergency C-section? I had already consented to an emergency C-section. Why did they not go with that route? And would things have changed if they would have done the C-section versus having the vaginal delivery? So for this video today, I want to help you understand some of the tools and how doctors are able to determine whether your baby is tolerating a vaginal delivery. And one of the tools that they use during delivery, during labor and delivery, is the electronic fetal heart monitor. And this monitor is just what I said, it's a monitor, and it's looking at the baby's heart rate among other things, and it's connected to mom, and it does a printout. I mean, it continually prints out, it does readings, and the nurses and the doctors, they can look at this monitor and kind of get an idea as to how the baby is doing. It's looking at, like I said earlier, what does the baby heart rate look like? Is the baby heart rate too high for a considerable amount of time? Is the baby's heart rate too low for a considerable amount of time? What are we dealing with decelerations versus accelerations? What about uterine, what about contractions and things of that nature? So the electronic fetal heart monitor, it's an important tool, and it's used in a lot of hospitals today, and it's something that doctors and nurses can use to help them assess fetal well-being, or to say it another way, how well your baby is tolerating that vaginal delivery. And so what can happen is sometimes the monitor can reveal that the baby is in trouble, or the baby is not doing well. There could be certain patterns. Like I said earlier, maybe the heart rate is too high for a considerable amount of time. Maybe the heart rate is too low for a considerable amount of time, or maybe there are late decelerations. Maybe the contractions and everything, nothing is meeting up like it needs to. So you could have issues like that. And when this is present, the nurses, if they see it first, they have to inform the doctors, let them know what's going on. And the doctors too, they've got to look at the fetal strips, and they've got to make an assessment as to what's going on. What can happen is if that baby is in fetal distress for too long, it's going on for too long, the baby is struggling, and doctors are continuing to use some of the conservative treatments, like moving mom around, turning on her side, giving oxygen or a bolus, or certain types of things like that. If these conservative methods are not working, then doctors have to be ready to move to an emergency C-section to help the baby out. Because what can happen is the baby's fetal reserves, in other words, the baby's ability to combat this issue that's going on, this lack of oxygen, the reduced level of oxygen, and some of the other issues that are going on, eventually what will happen is the baby will just tire out going through the process. And then once that happens, now you can, the baby can be in some really serious trouble at that time. So the purpose of this video today is to kind of help you understand the big picture. Maybe you're watching this video today because your baby has a brain injury and you're wondering, okay, should an emergency C-section have been done, or was the vaginal delivery the right way to go? How do I assess this? What are some of the things that we need to look at to be able to get answers to and to better understand what may have happened during the delivery process. And so for birth injury attorneys like myself, we are going to take a look at this electronic fetal heart monitor. That's one of the things that we're going to look at. Of course, the medical records for mom and baby also, but we're also going to take a look at these records in the electronic fetal heart monitor, the strips. We're going to take a look at that, and that can help give an analysis or help you analyze and be able to see, okay, was this a situation in which the baby went on too long and just ran out of reserves, and now we have a brain injury? So if you would like to speak with me further about what's going on, maybe like I said, you're watching this because you're wondering, should your baby have been delivered through emergency C-section versus a vaginal delivery, or did the doctors wait too long to perform the C-section? So if you have these types of questions and you would like to speak with me further, this is what I invite you to do. And remember, taking this next action, it costs you absolutely nothing. And what is that action? Pick up the phone and give me a call. I can be reached at 301-850-4832, or if you prefer, you can reach me toll free at 1-833-4BABY-HELP. You can also reach me by email, medicalinjury@bostonlawllc.com. We answer questions like this in regards to babies and families, HIE diagnosis or CP, cerebral palsy diagnosis, or some of the other issues that can happen during birth. So we talk to families about this type of stuff all the time. That is what we do here. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here at Boston Law Group LLC. And we will see you next time. Take care and enjoy the rest of your day.